My name is Martin Fox. I'm the medical director of the Clarity Refractive Services. I'm a board-certified corneal surgeon with about 30 years of experience in ophthalmology and ophthalmic surgery. I was on a track to be a cardiothoracic surgeon, and I was doing a lot of elective work in heart surgery. The problem with being involved in that field was there's a lot of death and dying and a lot of suffering involved. In ophthalmology, I saw a lot of happiness. So being an ophthalmic surgeon allowed me to do microsurgery and procedures that actually really improved and had a big impact on patients' lives. The other great thing about ophthalmic surgery was it allowed me to treat patients of all age groups, young patients, old patients, and everything in between, because there's really something we can offer all patients in ophthalmic surgery to improve their quality of life. So it's a happy field to be involved with. LASIK is the primary procedure that we use in providing for what we call laser vision correction. The cornea is the primary focusing lens of the eye. Laser vision correction allows us to reshape the cornea so that it can focus more efficiently and allow for clarification of vision without needing glasses or contact lenses. In LASIK surgery, the laser vision energy is applied under a flap. That interlace technology allows us to lift a very thin flap of tissue and allows us access to the interior of the cornea to correct the vision. I know when that patient leaves, we've provided them with something that's going to have such a positive impact on the quality of their life going forward that they'll look back on it as one of the best decisions they've ever made. Years ago when we started, we would limit ourselves to people who had terrible prescriptions. But as the technology got better and better, and as we became more sure that our outcomes were going to be good, we started to open the gates to people who even had minimal issues with their vision, because we know it's safe. And there are many people that we see who have very, very low prescriptions that are very annoyed by them, don't want to wear contact lenses. And we can honestly feel that we can offer them a chance to improve their vision safely. And so there's no reason to limit this to just people with poor vision anymore. But in general, anybody over the age of 18 is a good candidate for laser vision correction or one of our other adjunct procedures to improve vision. Well, when a patient walks through the front door, essentially what we want to do is conduct a consultation. And once that process has been completed, we'll sit down and we'll advise our patients what we think would work best for their individual problem. Those patients are then counseled as to what they need to do to get ready for surgery. In most cases, it means staying out of contact lenses for a couple of weeks. They're also counseled as to what medications need to be taken to get them prepared for their surgery. But in general, after a consultation is performed, in about 2 weeks, patients are usually ready to go for their surgery. And actually, the surgical part of it is the least time-consuming part of everything that we do. PRK is one of the families of laser vision correction that we use. It's a surgery that makes use of the same wavefront-guided custom technology that we do for our LASIK patients. But in this particular scenario, we don't make a LASIK flap. And the reason for that is there are occasional patients that have corneas that are too thin or may have problems relating to their corneal shape. And so for those people, we'll do the surgery in a way that doesn't make use of a LASIK flap. A PRK patient will have the laser vision energy applied to the surface of the cornea rather than under the flap, because in so doing, the surgery is less invasive. Of all the things that I do, I would say the ICL surgery right now is the most exciting. This is a technology that makes use of a lens which can be implanted into the eye. It sits behind the pupil. The beauty of the Visian technology and ICL surgery is that it expands the range over which we can correct vision. We were pretty much limited in laser vision correction to people up to about -9 or -10 in prescription. With ICL implant surgery, we can correct people up to -20. ICL surgery also allows us to do refractive surgery for people who may have been disqualified for surgery before because their corneas are too thin, because their eyes are too dry, or because there have been some pathological issues in the past that have made it impossible for them to get vision correction. Intex is a surgery designed to improve the corneal shape in people who have distortion from a disease called keratoconus. A keratoconic eye is one in which, because of structural weakness, the cornea becomes distorted in shape. And inevitably, for such a patient, the only thing that they can do to improve their vision is wear a contact lens, usually a rigid lens. Intex technology makes use of small semicircular rings made out of the same plastic that a hard contact lens is made out of. And using our intralaser femtosecond laser, we produce channels in the cornea into which we thread these semicircular pieces of plastic, which will improve the shape of the cornea. In improving the shape of the cornea, patients can find improvement in their vision with glasses, improvement in comfort in contact lenses, and in many cases it can allow a patient to get out of hard contact lenses and wear soft contact lenses again, and it can allow a keratoconic patient to avoid needing a corneal transplant. Corneal transplantation is probably the granddaddy of all refractive surgical procedures. In corneal transplantation, we're replacing the cornea of the eye, which is the major focusing lens, with a brand new one. And those surgeries are usually limited to people who have corneas that are so scarred or so abnormal that they're outside of the range of our ability to create improvement with one of the other procedures, such as laser vision correction, Intex, or ICL. But the good news is that even in corneal transplantation, we now can use some of our modern technologies. The same intralaser technology that we used to create the LASIK flap, we're now using for people who want corneal transplant surgery. The intralaser allows us to produce very, very accurate corneal cuts so that when we're doing corneal transplantation, the recipient and their donor match precisely like two pieces of a puzzle.